Hey guys, I'm Dr. Ruth Roberts. I hope you're having a great day. I'm the creator of the original Crock-Pot diet and have got a couple of questions for you that come up fairly frequently, but I think they're always worth repeating because I actually found a statistic in relationship to raw diet that kind of helps support what I've been saying. So I had some questions. I had a question from Kristen, who's feeding mostly raw food. And she's asking, why do I recommend cooked food versus a raw diet, which has been promoted as the ancestral diet? And so here's what I found when I was researching the setting up the Crock-Pot diet. The best I can tell you is that dogs, their ancestors were wolves or perhaps a progenitor species. So prior to the wolf coming into being, so there was a progenitor species that the wolf and the coyote derived off of, and ultimately the dog as well. And so that species certainly ate raw food, and that's no question about that. But what I want you to think about is that Canis familiaris evolved with us, Homo sapiens. And in fact, many anthropologists now believe that Canis familiaris is what allowed Homo sapiens to dominate and basically extinguish Neanderthals. But what that means is that dogs have been living with us for 30,000 years. We have been eating a cooked diet for 50,000 years, so both Neanderthals and Homo sapiens. And what that means is that these guys, yes, their progenitor species ate a raw diet, and that is their ancestral diet, but they've never really, eaten that. Yes, they will kill and hunt in the wild and eat raw food there, but that's not so much what they were evolved to do. And if you look at us, the species prior to Homo neanderthalis also ate a raw diet. Now, that's our ancestral diet too, but I'm fairly convinced that most people are not going to be really thinking that a raw meat diet is a great way to go. And I will also agree that the progenitor diets varied based on where they were. And so if they're in Africa, Europe, that kind of stuff, it just depends on what foodstuffs were available. And in fact, for many people, their foodstuff varied with the season, as is reasonable. The other thing I want you to remember too is that when people talk about paleo diets, they're really not quite paleo diets. So there is evidence that we were baking 30,000 years ago. Now I will say that those were grains that were gathered wild, and so their makeup, especially for wheats and things of that nature, is very different from the main varietal of wheat that's in use today. So that's part of why it's thought that we're having such difficulty with gluten and gluten intolerance and things of that nature. So that's one of the big reasons. One is that I'm not really convinced that it truly was an ancestral diet. I think it is for the progenitor species, but not for Canis familiaris. The second is, and finally I found a statistic to kind of back this up, and I've got to research this a bit more, is sustainability. I mean, at this point, the statistics I saw was that 25% of U.S. animal flesh production is turned into pet food. Wow. So if cows are actually responsible for most of the global warming, do we want to feed dogs and cats more vegetables or more protein that's going to require larger inputs in terms of food, water, energy, and frankly, animal cruelty? Because conventionally raised animals, it's a pretty ugly thing. And we eat grass-fed or naturally raised animal products, but for the dogs, I can't afford to feed them all that. So we use conventionally produced proteins, and we'll just use leaner cuts and then add in a better fat. So the idea being is that conventionally raised proteins have an improper omega-6 to 3 ratio, meaning the omega-6 values are much higher than the 3s. The omega-6s are the pro-inflammatory molecules. omega-3s are the anti-inflammatory molecules. So one of the whole big things behind grass-fed or pasture-raised animals is that they have the proper ratio of omega-3 to omega-6, so that all of a sudden they actually rival fish in terms of being an anti-inflammatory protein. So that's reason number 2. And because my brain skips around, I'm going to look over at my notes. So we've got the fact that actually their progenitor species, probably was eating raw diet, but they've raised around eating what we have left over. The exception to that truly is the cat. They are obligate carnivores. Dogs have evolved with us to be omnivores, so meaning they can eat everything. Cats, though, interestingly enough, is that they really are obligate carnivores, and we've been feeding them profoundly high carbohydrate diets, which has probably created the vast majority of disease that they're experiencing. So the other thing is that while raw diets will include some vegetable material, that's not as much as I would like to see because of the phytonutrients that are available in things like broccoli, kale, all of those good things. It's just, it's so important to include those in there. So that's the other big reason too. So I hope that answers your question, Kristen. The other thing I will tell you is that you have to look at that little dog or that little cat staring at you. What's doing it the best? Is raw really making that dog or that cat look awesome and have vibrant health? Then that's the right way to go. Is it not looking so great and the digestion's a little spotty? Then cooked food is probably a better way to go. If you are not sure and you're interested in raw, then I would try some raw food for a short period of time and see if you see any changes. There are tons of resources on the web. Dr. Falconer with Vital Animal has a lot of info on that. Karen Becker had a book about feeding raw things and had some recipes and things of that nature. Regardless of how you feed, whether it's raw or cooked food, if you're making it at home, you do need to make sure that you are balancing it appropriately for all the nutrients your pet needs. So whether it's holistic total body support, which I made, developed and had included glandular products, or whether it's another multivitamin, do use that. Make sure you are using the right stuff. And Colleen's adding a good point. She likes to use frozen veggies, and is that as good as fresh? And not quite as good, but it ain't bad. And I will give you a codicil about that and say that sometimes it just depends on the where you're getting your fresh vegetables from. So frighteningly, they can irradiate the veggies and store them for up to 6 months. And so in that situation, frozen veggies are probably better. So again, do what you can do that's going to be consistent and easy for you to maintain. Does that make sense? Hope so. The second question I had today is from Jennifer, and she's got a question about her kitty. He's 9 years old, and he's having chronic UTIs and cystitis with bacteria now, sometimes not, that kind of stuff. He's just finished up a round of 2 different antibiotics and had an ultrasound done with no stone or other abnormalities. And just now he started going into the litter box and straining and passing a little bit of blood. And they don't know what else to do. And these get terribly frustrating sometimes. So the thing to remember with cats is that they're like us, ladies. So I don't know how many of you out there have had chronic urinary tract infections or stress cystitis or interstitial cystitis. If you've had that, raise your hand. It's not fun. My poor mother jokes, but it really, now it's a joke because it's 20 years later. She jokes that she stopped having cystitis the day that my brother graduated from college because he was a bad boy, and he's thankfully turned into a good man and a great father. But that's the thing that we forget about with cats, and that's what often happens, is that they're actually stressed or they're anxious or something is just really tripping their little triggers and making them very unhappy. So what can you do besides waiting for it to happen again and going and getting more antibiotics or blah, 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 something to control the inflammation? So here's the plan. One is go with a low carbohydrate diet, almost a keto type diet. So chronic inflammation is spiked up by high simple carbohydrate diets. This can be a real battle. If you're feeding dry food, what I would do is switch first to canned food for cats. If you can get them to eat canned food, that's going to actually reduce their symptomatology simply because they have more water in their systems. If you can get them eating canned food, then you have a better chance of actually changing how their diet is structured to a more keto type diet. Cats are very much like us in that they eat when they're stressed and they are carb addicts. So cats will literally make themselves sick by not eating for 3 days or more and develop hepatic lipidosis, which is not fun because they're burning all the fat in their body and their poor little liver's choked off. So, that's the first thing that you should do, but your cat may not agree with you. So be sure to go very slowly. Don't push the issue. Take it at your cat's speed. So I hope that makes sense. The second is make sure that you get a urine culture and sensitivity at your vet's office, because a lot of times we'll throw antibiotics at these infections because we see bacteria. Sometimes they're bacteria and sometimes they're not. And this is the opposite is also true with cats, is that we can have a normal urinalysis or sediment exam, meaning nobody saw any bacteria in the urine sediment, and yet that animal will still culture out a bacterial organism. And conversely, you can see bacteria in the sediment, but nothing cultures out. So remember, an exam of the sediment is a subjective thing. You're actually looking through a microscope and saying, yep, that looks like bacteria, and writing it down. So get a urine culture and sensitivity before you throw more antibiotics at it. The second is that if you have had issues, or your cat has had issues with its GI tract, as far as vomiting periodically 2 to 3 times a week, constipation or diarrhea, things of that nature, often they get chronic urinary tract issues because they actually have gut dysbiosis. And so if you think about how things are laid out in the body, this is the cat's backbone, this is the cat's colon, and then here's the cat's bladder. Guess what is sitting next to each other? The bladder and the colon. So if there's dysbiosis or bad bugs in the colon, they can translocate or actually migrate through the colon wall into the bladder wall and into the bladder lumen, because they're actually, sitting there really tight. So make sure that the cat's gut health is squared away. Generally, they will eat things like probiotics, and probiotics have been shown to help reduce inflammation in the bladder and improve symptoms in women with urinary tract disease. So, A, make sure you really do have a bacterial infection, and then B, if you have used antibiotics, make sure you're re-inoculating the gut with probiotics. And if your cat has chronic UTIs, then use probiotics on a regular basis. So, I'd start out daily and do that for a month, and then go to every other day. If you see no return of symptoms, then try twice a week, and then finally once a week. Use a high, no, don't know what the sad, angry face was for, but anyway, UTIs are not fun. So use a high dose multi-strain probiotic, so Probiotomax, which we have manufactured and carry, is great. I've been using it for many years because it is a great probiotic, has multiple strains, and it has 100 billion colony-forming units per dose versus, say, 5 to 15 billion CFUs in a conventional product. So that's important. If you believe that your cat actually has more GI issues, and then when the GI issues kick up, the bladder issues kick up, then that's where I would focus your efforts on doing the gut health program or something of that nature. As far as other things that help to control inflammation, so we've done a urinary culture, it's negative, there's no bacteria, this cat is really just stressed. So we want to do a couple of things to help reduce the stress and the inflammation. So one is the probiotics, obviously, fish oil, Adequan injections, joint supplements. Believe it or not, glucosamine, chondroitin, and MSM are anti-inflammatory molecules, and they don't just work in the joints, they work all over the body. So that's quite helpful. D-mannose is an interesting sugar that's, again, that you can get over the counter in the drugstore, and probably about 100 milligrams twice a day for a cat. The way this works is that it does two things. One is it prevents E. coli and Pseudomonas, which form little tiny feet that stick to the bladder wall. It prevents that from being able to stick. The other thing it does is it seems to reduce inflammation in the bladder itself, and because it's a sugar, although it's not going to show up as a sugar in the urinalysis, it does also help to lyse the bacteria because of osmotics, because that's just fun. So if you've got same thing, if you've got a membrane, lots of sugar over here, not so much over here, then the water comes through the membrane over to where the more sugar is to dilute it out. Well, what's happening is the bacteria are the ones that are losing their water over their bacterial cell walls into the bladder, and so the little buggers die. So that's usually a pretty easy sell because it has a relatively sweet taste, and you can sprinkle that on the food and mix it in, so it goes around pretty well. We've used bladder support for years, which helps to reduce heat and inflammation. In Chinese medicine, bladder issues are considered to be bladder damp heat, so anything that dries up damp and drains heat will help reduce bladder discomfort. So bladder support includes several, actually like 8 or 10 ingredients, some of which are consistent with traditional Chinese medicine, and some are more consistent with the Western herbal tradition. The other thing is, okay, we're back to that whole anxiety idea. So for women, amitriptyline were used for years to help us not be so anxious and have to pee every 27 seconds. Same thing with cats. So there are drug options. The other things that you can use are things like Feel Away, especially at or the litter boxes, around feeding stations. If you've got cats that fight, where they tend to kind of launch those fights, you would want to use a spray or a diffuser in that area. And then liquid Nutricalm is another thing that is really awesome. So it is a tryptophan and theanine based product, and it helps tremendously to just kind of bring the stress level down a few notches. And much like us, cats, we have to practice not being stressed out to get the benefit from all the things we're trying to do to reduce our stress level. So that's what I've got for you today. I'm glad to see so many people watching today, and I think there was a couple of questions back here, so let me see if I am smart enough to stroll back through that. And Colleen says she uses frozen because she has less waste, and I think that's a fair point. Dan's asking about Grace getting over a bad ear infection, and unfortunately this thing only gives me about 2 or 3 lines, but her ear was really painful, and vet gave us meds for that. I hope it's better. Again, chronic ear infections, the most common cause of a chronic ear infection is the first ear infection that never got completely resolved. So Dan, I would make sure that infection is clean, that your veterinarian can see her eardrum and that is intact. And that's going to let you know that things should be a relatively mild ride going forward. But I think probably what's on the back end of that question is why. And often it's due to allergies. So whether that's seasonal allergies, food allergies, environmental allergies, molds, pollens, dust mites, things of that nature, those are all big issues. So one thing that can help with that is, again, the gut health program. Often intestinal dysbiosis is underlying many of these chronic inflammatory conditions, and so by fixing that and sealing off the gut, you reduce the level of inflammation that animal is experiencing. So if that makes sense, great. If this is a situation where this has been a chronic ongoing issue, if you have not done any allergy testing, I would definitely look at that. HESCA has a test that is a blood sample, so most veterinarians can do this. The upside is that they have a liquid oral hyposensitization therapy, so you do not have to give injections. And because it's an oral one, they can actually include things like dust mite allergens and molds, which are very common in the Southeast, and we find often quite frequently associated with chronic ear infections. So I hope that makes sense. And I'm just going to take a piece. pace back through here and it looks like I've got all the questions answered. Guys, I really appreciate you tuning in today and sharing this with your friends. It helps us tremendously. So if you are not feeding the original Crock-Pot diet and you want more information about that, head on over to our website. We've got a giant year-end sale going on. And what I'm going to do right after this is go into our Crock-Pot Cooks community, which is specifically for people that have purchased the original Crock-Pot diet, the gut health program, the kidney health program, and do a broadcast on cancer and sort of general treatment guidelines, and then answer any questions I can about more specific issues. So if you want that kind of information where I can talk more directly with you about your pet, that if you purchase any of those products, and the gut health and the kidney product both include the original Crock-Pot diet ebook and membership, this is a good time of year to do it. We've also got some very exciting stuff coming up within the next week or so as far as being able to offer a little bit more in-depth and personal email consultations for your pets. So keep an eye out on the Facebook page about that. It's coming. And if you didn't see it, there's an extremely cute video, and I'm saying this because they're my guys, Pepe and Esau, chowing down on holistic total body support and Crock-Pot diet pinned to the top of the page. And it also gives you the information about the sale for the year end. So hope you guys have an amazing day. You have safe and happy holidays, and I will see you next week. And glad to see so many people on board. Take good care. And remember, and Terry's saying, how do I join? I've got the diet purchased. So if you've already purchased one of the products, just type in Crock-Pot Chef. Sorry about that. So much for Do Not Disturb actually working. But anyway, once you've purchased the diet, go over to the Crock-Pot Chef's Cooks community and just click join. If you're using the same email address on Facebook that you used to purchase the product, we'll get you covered here pretty quick. It'll ask you some questions, fill those out. So remember guys, your pet's best health starts in the bowl, and take good care.